Welcome to my podcast. Today I'm going to talk about another case, which is common as well. So basically, after introduce yourself and double check the patient name and address as we always agreed, you'll ask the patient, how can I help you today? So the patient might say that, doctor, I'm having pain in my tummy, and it's in the lower part of the tummy, and it could be associated with other symptoms. So you'll ask the patient, can you tell me a little bit more about it? And then you specify your question. Say, for instance, when did it start? Can you point with your finger where about exactly? And if it's more than 6 months, so it could be chronic. And also you'll ask the patient if there is any triggering factor, and if the pain on a grade from 1 to 10, how would you grade it, where 1 is least and 10 is too much pain that you can't tolerate. You'll ask the patient if there is any trigger cause for the pain and what might ease the pain. You'll ask the patient about the characteristic of the pain and if there is any radiation. So the patient might say, I'm having sharp or stabbing, or it could be burning, and if it's sudden or insidious. And also if it comes and goes, and if it's constant, and if it's dull aching or feeling of a pressure or a sharp twist or cramp, dropping, all sort of pain. And you will ask if there is any issue with the V and P. And then you will ask the patient if they can, as I say, V and P, and if there is any history of constipation, if there is any history of dysuria, burning in the V, if there is any pain, if the patient is sexually active, you will ask about the sexual life history. So if the patient is sexually active, or if there is pain during coitus. And also he will ask if the pain is referred. Sometimes it might start in the right iliac fossa and migrate to the umbilicus, and which could point out, of course, to appendicitis, and you will do the test for that. And if it's a young lady, you will ask her when was the last menstrual period, just to estimate if it's period pain or maybe it's miscarriage or ectopic. And he will ask if there is any history of bloating, abdominal distension, which could point out to ovarian issue, like for instance cancer or cyst, if there is any swelling. And you will ask if this happened before or not. And in case of men, you will ask about their wee and if there is any dysuria as well. And you will take it from there. And also you need to probe about certain questions. If you were thinking about, for instance, the patient saying, I have stati and feeling bloated for the last couple of weeks, you will ask if there is any history of weight loss that's unintentional. And if there is any changes in the wee and poo, or if there's any unusual discharge or blood, any of that. And of course, after that, you will ask about the other questions, which basically about any medical history could be associated with, and family history, history of allergy, and also the drug and medication that's been taken, any history of medication that's been taken, and social history, whom they live with, work-wise, and lifestyle questions as well, exercise, drinking, smoking, all of that. And then you will agree with the patient after you examine them, just to see what about the pain, if there is any tenderness, if there is any swelling, if there is any gases, for instance. I'll ask about, as I say, when I say about we and poo, ask ask about flatus, if the patient is able to do so. And then you will treat and tailor the treatment accordingly. So, for instance, If you suspect something, you will treat it accordingly and according to the case presented. So by that, I hope that I covered the major points of any lower abdominal pain, which is basically pelvic pain, and how we can take it forward, and always never to safety net the patient, stating that if your symptom not improving, if you have difficulty to poo, if there is any unusual things, if there is any shivering, temperature, if you lost if you are not feeling well in yourself and not improving, always come back to your GP or ring the emergency or go to the A&E immediately. Thank you.